Hello, everybody, and welcome back to the main stage sessions at the International Rare Disease Showcase. Really glad to welcome you back today to dive into what should be a really enjoyable and interesting session. To start with, though, I'll just do a big thank you to the people who are supporting this event once again. Obviously, everyone's here on free ticket, which is fantastic, and getting to pull together a really diverse community. And it's thanks to the people that are supporting the work here. So our corporate partner Helix, our gold sponsors Pulse Infoframe, Bionicle EMAS and Apparito, our silver sponsor EusaPharma, bronze sponsors Gilead, PTC Therapeutics, Roche and Rhythm, and then finally our supporter, the National Community Fund, who've given us a grant as well to help run this and put it together. Thanks to all of you guys to make this possible. So today's session, our second one on the main stage, is focusing on policy and how rare disease policy is developing across the world. This is obviously really crucial and fundamental to how rare diseases are viewed by governments, the funding that's available to us, and how we can hopefully push things forward in an effective way. So it means a great deal to see how we can drive this. And as you probably guessed, you are stuck with me today as your host for this session, but it's one I'm really excited to engage with, and looking forward to put your questions to our excellent panel of speakers. So those speakers are seen here on this delightful graphic. What you can see is a really great panel of experts here, and a panel that's helping us cross all around the world. We really want to make sure we're touching on different scales of policy work and also policy work across the globe. So I'm pleased to be highlighting talks from Rare Disease International, who are going to speak towards the end of the session, highlighting some work on the UN resolution lately. We have Eurodis, we have Jeraine Monriga talking from the work in the Asia Pacific region, and also featuring then stories of patient groups that have made differences or trying to make differences in their local communities. So Kelly du Plessis, speaking from South Africa, and Rare Disease South Africa, and Bojana Miroslavovic, speaking about her amazing work in getting the law put together in her home country. So I'm really excited about this session. I'm excited to see how you guys can engage with us. So please do get ready with those questions. I want to see as many questions coming into the Swapcard platform as possible. You can see the question box down there. I think it's probably down here somewhere where you can click in, put those questions in the chat, and make sure they all feed to me so I can quiz our expert panel. Okay, so without further ado, I will stop my screen share and welcome to the stage today's first speaker. So I'm really happy to welcome Bojana. Actually, we've been doing a little bit of work together for a number of years now, and she's got an amazing background and personal story in rare disease advocacy. So Bojana's going to be telling us a fair bit about her personal journey with Batten disease and to move forward policy changes in her home country, and how that's rolled out and led her down this pathway to rare disease advocacy. So Bojana, welcome to the stage, and look forward to hearing from you.
Thank you, Rick. Good afternoon to everybody, and thanks for having me here and for the opportunity to tell you a little bit more about our fight, my fight. So just for the beginning, I would like to share with you one video, and after that, we can start. Good afternoon to everybody, and thanks for having me here and for the opportunity to tell you a little bit more about our fight, my fight. So just for the
all those times you stood by me, for all the truth that you made me see, for all the joy you brought to my life, for all the wrong that you made right, for every dream you made come true, for all the love I found in you, I'll be forever thankful, baby. You're the one who held me up, never let me fall. You're the one who saw me through it all. You were my strength when I was weak. You were my voice when I couldn't speak. You were my eyes when I couldn't see. You saw the best there was in me, lifted me up when I couldn't reach. You gave me faith 'cause you believe I'm everything I am because you love me. Ooh.
Okay, so now I will try to share my screen. Can you just tell me, is it okay?
Perfect. All good.
Okay. Okay. So I'm Bojana Mirosavljević. I am founder and president of a rare disease patient organization in Serbia. By education, I am chemist and I am embryologist. I work as an embryologist in fertility clinic in my town. And I also have a pleasure to be patient voice in a global CRO company named Ergomed. So, nothing happened with the slides. Okay. But above all, I am Zoya's mom, and you saw Zoya in the video. So these are just statistics you've probably seen many times before, but they always remind me why I do what I do and that I have to do even better every time. So, and please remember, it's one thing when it's just statistics and some numbers in some presentation, but trust me, believe me, those numbers take a whole new dimension when you or your child are part of that statistic. I will not go through, but just several statistics, you know, a specialist until patient get correct diagnosis is really too much. And for example, Zoya get 8 misdiagnoses, but I presented here just an average numbers, you know. I don't know if you knew this, but 5 new rare diseases are detected every week. And of course you knew, but 95% of rare diseases are without therapy. So I think we all should be better. So in the next few slides, I'll just give you a brief overview of our fight, even though you saw a good part on the video. Our path to diagnosis was very hard, but I will not go into more details because on one of the slides, I present a link to the documentary film Zoya, where you can see more about our fight for the diagnosis and the fight for Zoya's law. But in short, after years of searching and bunch of misdiagnoses by doctors, we decided to take Zoya to England, from Serbia to England by our own. We organized and paid, of course, everything by ourselves. So at that time, it was not possible for a doctor from Serbia to send blood samples somewhere else abroad. And in London, they quickly found out what it was about because they already had experience with that disease. So we return with that kind of devastating knowledge and about the disease of our girl to Serbia, where no one knows anything about it. No one of doctor could help us, instruct us more and give us some information about the disease. And then our first steps were to go to US for the annual Batten Disease Conference organized by American Association, Parents Association, and they teach us everything about the disease. They educated, they inform us about symptoms which are waiting for us in the future, etc. We went every year. So I just presented some of the conferences. So at that time, we had already founded an association in our country. And through that association, we brought experts from US on Batten disease to educate doctors in Serbia and talk to families and the patients, you know. So you can see here left slides on the left slides down famous Dr. Catherine Sims. She's really one of the biggest experts. She's now retired, but she teaches a lot and she educated our doctor about Batten disease. Then we organized the first conference of neurological disease in Serbia. And you can see that there was a great interest in this kind of event. So what we accomplished, that we sent one doctor from Serbia to train in US. we founded organization in Serbia. We were one of the founders of National Organization for Rare Diseases in Serbia, named NORBS, and basically these were the founders. In the meantime, we were 8 times in China on stem cell therapy. Yes, I know it is, we can discuss about this treatment, but from the beginning, China's doctor were very honest and told us that it is not a cure. And in that time, we just tried to buy some time for our children, you know, because in that time, we hope that we will manage to get the therapy for our kids, but we didn't succeed. Time beat us, obviously, but I will repeat everything again. If I had the chance to help her 1%, I will do it. I will go at the end of the world, you know. So, but you see how these children are so brave. So here are just a few slides to try to show you how we try to raise awareness about Batten disease and our problems. And we really had a great support from the media. We organized tons of founders, charity events, dinners, concert, games, etc. So we really had a great support from the media. In our health system, we had noticed different things, so very limited experience of this kind of the disease, big problem with diagnostic, also limited leave of the parents. So parents, we had the situation that parents often get fired from the job because they need to take care of their sick child. Really general unpreparedness of that healthcare system and institution to care for this kind of the disease, and outdated laws and regulations. So very often we had a feeling 1 step forward, 3 steps back, and so in the magic circle. You know, for example, we managed to put one anti-epileptic on a positive list of the drugs, which means that the parents does not pay for it, but you know, health insurance, but it is not never available in pharmacies. So, you know, who cares if the therapy is on the list, but anyway, parents cannot have it. So, you know, like a magic circle. So this is what the Serbian parliament voted in ZOAS law. So actually it is only law in the Serbian parliament which passed unanimously in the history. You know, it has not happened before that unanimously law is adopted. So miracles are still possible, and Zoya and that 6 children united all deputies with their strength and braved. So what is exactly Zoa's law? The main point is that if after 6 months it's not possible to establish diagnostic in Serbia, the doctor is actually obligated to send a sample, some sample of blood or tissue, depends on the disease, in some reference laboratory. Also prenatal diagnosis for the families with the diseased member, and testing of family members who are potential carriers of pathological genes, because, you know, we think that mapping of that genes in families are very important, and pre-implantation genetic testing is also proved by health insurance. So it is very interesting how was the voting for the ZOAS law, but you can see, you can really watch all details about that in the documentary film. I presented first time ZOAS law in Rare Disease Day event in Brussels by who organized Eurordis, and also in European Parliament in Brussels, in European Nation in New York in November. Also, it was a really great event. I think some of the presenters were there present. So just I will not go into detail about the EUPATI because I'm pretty sure you all know. But EUPATI provides a training for patients representative for medicine research and development. But why it is so important? Because trained patient experts are the core resource for patient involvement in medicine research and development. So the goal is that the patient or patient representative meaningfully contribute and to improve the availability of medical information for patient and other stakeholders. It is very important to make sure that everything that is done for the patient actually is done with the patient. And EUPATI give us tools, knowledge, and skills for that. To be able to do that, we need to understand the whole drug development process, and you can make a difference only in that way. EUPATI gives us some kind of map with instruction on where and how to walk through the research world and drug development process. So I basically get, so for our work, we get several awards. First one was from National Organization from Serbia, then from American Chamber, like a Hero of the Year. Also, Eurodis awarded us Black Pearl Awards for our magazine about rare diseases, the only journal about rare diseases in the whole region, Balkan region. Here is just a few photos from the award ceremony. And in my town, Zoya Mirosavljevic has her own street. Basically, citizens insist that she get her own street. So now in my town, we have Zoya Mirosavljevic streets. And this is my this is my biggest accomplishment. You know, these two little girls are Zoya's sisters, healthy sisters. They are not even carriers of the Batten gene. So we stopped Batten disease in help with pre-implantation genetic testing, which is my passion. And so these two little girls are my daughters, and they are we get them by pre-implantation genetic testing. And this is our victory. This is the first boy in Serbia, in the whole Balkan, who get the enzyme replacement therapy for Batten disease, and he's together with doctor. And just a few words about rare disease database for Balkan, that it is a region project with the signed agreement on cooperation with all national organizations from Serbia, Croatia, Bosnia, Macedonia, and Montenegro. The need for that kind of project on our language has appeared due to lack of accurate and complete information on diagnostic that can offer answers and adequate therapy. Because according to the information available here, over 27% of Balkan physicians do not use English functionally. And we then decided to give them all information on our language, you know, about rare diseases. It was a huge project, and actually it is officially Ministry of Health on their website put a link to our database for Balkan region as a relevant source of the information, and it is really great things. And it is just a few pictures from last year regional conference. Here with me, you can see mayor of my town. This is Ministry of Social Labor, and the next to me is the First Lady of Serbia. So we get support from government. And that's it. I hope I did manage to put all in good time frame. Rick, am I good?
Absolutely fantastic, Barney. Yeah, really nicely timed, and an amazing overview of some of the work that you've done on what must have been a really long and at times painful journey. So thank you for sharing that. I'd just be interested quickly from me. It's amazing some of the stuff you've worked on and some of the change you've brought about. I just wondered where that first idea to try and introduce Zoya's Law came from, and how you felt about trying to get over that hurdle, you know, as a patient association
Yes.
based in Serbia. That feels like a big step. Obviously, you had a lot of media support as well. So how did that come about for you? That
Yes.
idea?
Well, it is a really big step because until now, in just 7 years, so 2015, it was adopted. So as law, so it has saved more than 3,000 lives. So, but really, it is you know, if it saved one life, it is worth the whole travel. You know, it is somebody's life. So yes, it is big step. But you know, idea came through. When we didn't know what is with Zoya, so we get many misdiagnoses. You know, I had a feeling the doctors played, you know, with diagnostic, you know, 15 minutes they came, it is Lennox-Gastaut syndrome. Then after 15 minutes, another doctor come through, it is Rett syndrome. Then 15 minutes after, and then I go, okay, we are not on the playground playing with diagnostic. We need to go somewhere, you know, where they know to tell me what is with my child. And we go through, they told us very honestly, they told us, okay, we don't have technology, we don't have experts, we cannot help you. You need to go somewhere abroad in some other countries. You go in the health insurance, you just they will sign you some papers, and they gave us, you know, all papers from the doctors which we needed, and they gave us, and we went through torture there in health insurance, government health insurance, because it is the only possible insurance here in Serbia in that time, and we didn't have other choice. We all citizens here have that kind of insurance, and we went there with Zoya. But just to mention that Zoya in that time had more than 200 epileptic seizures in one day, you know. So you know, she was really, really bad. We didn't know how to stop that seizures, how to control them at all. So in that time, we went to health insurance, and they told us, I will never forget that sentence. We cannot pay you that diagnostic, you know, in London, because Zoya, I will quote that guy, Zoya is collateral damage of this country. And that was the main reason for Zoya's law, you know, because I really, in that moment, we didn't have time and strength to fight with him. But after we get our diagnosis in England, in UK, we sue the health insurance, and we won.
Yeah.
And that was because we are the first family in the Serbia who won after against the health insurance, because it is very difficult to beat them in law, process, and we beat them. The process lasts 5 years, but I didn't want to give up, and it was very hard because we need to tell every second of that horrible period of our lives, you know, to the judge, and we beat. And actually, that was the base of the Zoya's law. That was the reason, you know. I didn't want to allow to anybody go through what I go through.
Yeah, and it's an amazing achievement, and an amazing legacy for Zoya as well. So thank you for sharing it with us. I'm sure we'll come back at the end of the session, if there's time, and dive into some of your experiences a bit more. A really nice reception and comments in the chat going on right now. Welcome and thanking you for your presentation. So thanks again, really appreciate it. So with that, we're going to move on to our second speaker. So I'm really pleased to welcome to the stage Kelly du Plessis, who's from Rare Disease South Africa. And Kelly's going to talk to us a bit about the work that she's been involved with, finding ways to move forward policy changes in South Africa itself, and possibly looking then beyond to Africa as a whole. Kelly, thank you so much for being here, and welcome to the stage.
Thank you so very much for having me this evening. It's evening where I am. We really, really appreciate it. So I'm going to just give a little bit of an overview of what we have done as a patient organization, and kind of the learnings that we have had with regards to policy development over the years. Bearing in mind that when I started this journey, I was similar to Bojana. I was just a mom, and really had no idea on the intricacies and sort of the healthcare landscape and the healthcare setting So I came into the situation very, very naive. And I kind of just presumed that, you know, if you needed something, you made a request, and then somebody on the other side of that mail would just kind of make it happen. I really, really had absolutely no idea that the complexities when it came to accessing services and treatments. And through my own journey with my son, we've kind of obviously gone into a position where, as a group and as a collective patient organization, we are now really, really focused on advocacy. And part of advocacy is obviously changing policy and changing the mindsets of those around you. As an organization, just by way of background, we are an umbrella organization, and we serve approximately 180 support groups, and we have over 5,000 patients who are registered with us. So we advocate for individuals on an individual level, as well as diseases on a disease-specific level. So it is relatively twofold. And I'm sure for anybody who's ever seen South Africa generally in the news, we're not in the news for good things other than rugby, but you will understand that this is a very, very political environment, and it hasn't always been to our advantage. And unfortunately, whilst we have really great science and healthcare, we have a really big issue with regards to accountability. So we have one of the strongest constitutions in the world, and our constitution is very, very clear regarding the patient's rights to access healthcare and access services. However, because of the political environment, accountability is often not always there, and as a result, the system fails. And I think it's even worse, you know, for the vulnerable and unknown conditions such as rare diseases, which is where our passion is. But also when you take into account the amount of comorbidities, as well as the competing health criteria and the health diseases that we are impacted by in the form of HIV, TB, malaria, it really, really makes for a very, very compounded and difficult situation. So I'm going to quickly pull up my screen if I can, and try get that going. I think you should all be able to see it now. So this is a little bit of our advocacy approach. And once again, it's ours. It isn't necessarily cast in stone, but these have been some of the key learnings that we've had. And I really just hope, even if it's, you know, as an organization, I always say some of the groups that start off, you're really just so overwhelmed by everything that you feel that you need to be doing. So sometimes it's really, really easy to just split it up into bite-sized chunks. So firstly, I want to address the issue around social impact, because before you can understand why, you know, before you can understand what you need to do to make policy change, you need to understand why we're trying to do it. And I think one of the big issues is that, particularly in the rare disease space, there's often this perception that the issues are predominantly healthcare related, and that's actually not the case. I think with any life-limiting healthcare condition or burden of disease, you will always have a very, very high social burden as well, and the social impact is often vast. And certain things that we see in our families are obviously the association of guilt, given the genetic composition of many of these conditions, financial burden, stigmatization, stress, depression, and anxiety. We have really, really high rates of divorce, as well as limited education and work opportunities, isolation. So all of those things. And I once again relate back to the COVID environment, where I think we've all kind of, even those people who haven't been impacted by a rare condition previously, I think we all kind of understand a little bit better now what it is like to be impacted with these conditions long term, because I think we've all had a bit of a taste of it over the last 2 years. So then with regards to patient advocacy, we often get asked the question, you know, we battle to identify with being patient advocates, and we very often have new support groups that come into contact with us, and they're like, no, that's not what we do. We don't do advocacy, because there's this perception that to be a patient advocate, you have to have been like super glamorous and super effective. But if you've ever requested improved pain medication, if you've ever argued for improved treatment outcomes in your day-to-day setting, even if it's with regards to something simple like the basic flu or a headache, or you've requested that you actually want certain tests to be done within healthcare, etc., you have essentially advocated. So advocacy is perceived to be this big, scary thing, and it isn't always. And that's one of the first things I think it's important for people to remember. Then when you look at what the elements of patient advocacy are, there's various elements, and it doesn't always mean having to bang down somebody's door. Being a good patient advocate, you aspire to certain values, and that's education of patients and their families, it's education of healthcare providers, support and information, collaboration and sharing, representing patients in other forums, building awareness, ensuring access to healthcare and medical technologies, defending the rights of patients. And all of those things go on to form part of patient advocacy. So patient advocacy isn't always just the defending the rights of patients passionately. There's very other elements as well. In South Africa, one of the big challenges that we have is that we have a dual healthcare system. So we have approximately 84% of our population accessing services in the state sector, and then we have 16% population who are accessing services via way of medical insurance. And as a result of that, we have a massive dichotomy between the two sectors, and really there's vast differences in terms of the service delivery and waiting times, and also the accessibility between the two. We're also plagued by lack of knowledge and general awareness, lack of data, which continues to be a problem. We have had no local definition. We are 99% of the way to resolving that issue. And we also have no orphan drug policy. And again, there's a separation between orphan drug policy as well as a rare disease policy in place. But if you look at the combination of all of that, that ultimately will resolve, if you can resolve all those issues, you would have improved access. And at the moment, the access is limited because of the combination of factors. So if you look at this line over here, we have all the various solutions that we think are suitable and that we've worked in putting into place. So in terms of the dual healthcare system, we've needed to find some form of mechanism to equalize the risk. And I know there's always a big issue around, is risk equalization and risk sharing the best method? But when you've got such a vast difference between the two systems and they almost play each other up, you need to find some way to bring them together. And risk equalization definitively has been one of the massive things that we have seen from policymakers wanting within the South African space. We obviously do what we can to increase the knowledge base. We are doing everything that we can to improve surveillance in South Africa, and we have worked really, really hard on developing a definition that is suitable to South Africa and is applicable in South Africa. And we are now busy in the process of developing our policy framework, and hopefully all of that will resolve in improved access. So this little screen over here is what I fondly know is our theory of change. And this is something that I refer to all the time, particularly on the days when I feel like we haven't succeeded and we're not getting anywhere, because I take a step back and I realize that Rome wasn't essentially built in a day. And it's also really important to understand that with advocacy, it's a very, very slow process. And a conversation that you have today might only bear any fruit 5 years from now. So it's a very, very slow moving target. It's often not very, very tangible. And sometimes it's really, really difficult to remain positive when you feel like you keep, bumping your head against the wall. But on those days, I come back and I look and I'm like, okay, no, we actually are not doing as badly as we thought. So the first thing is with regards to fundraising. And fundraising forms a fundamental element of any sort of advocacy of any kind in any policy development, because you need to be able to develop a pool of funds that will actually drive the process. The second element is with regards to data collection. You need to have an idea of what the problem is and what the impact is, and then move on to a problem assessment, where essentially you're evaluating the what's, who's, and how's, and ultimately what you'd like to see come from any policy that you're developing. Further to that, you move into the phase of landscape mapping and policy assessment. And that's essentially where you start looking at, okay, based on our problem, who do we need, who's necessary to assist us in terms of developing a solution to this problem? It's identifying those individuals and also working out what tools you have available within your country. So in our case, the constitutions formed a pivotal part of our work, because that is the overarching law in our country. and that is essentially our Bill of Rights. So that's been a fundamental portion of existing policy that we could leverage from. Once you have that determination and you've done your stakeholder mapping, you can move over to the partnerships and alliances. And there we start splitting out because partnerships and alliances are sometimes very, very different to coalition and network building. So it kind of splits into two areas. So you have to develop messaging that will essentially appease both sides or both areas. One being the partnerships and alliances are individuals and groups that will assist you in navigating policymaker education. And the coalition and network building is more for public awareness. So this is, I always say, this is the community engagement, etc. It's the work that we do with peers and colleagues who are impacted by rare diseases or in healthcare. And the partnerships and alliances are more of a political element where you are leveraging strength that is already out there and kind of latching onto those developments and those programs in order to get to the section of policymaker education. With policymaking education, the intention of that is that you will come out of that, and the interim outcomes would be change political will, as well as identifying new champions. And that is people within the political system who are able to get you across the line. And with regards to public awareness, you are wanting that change public perception, because that public perception ultimately is what holds these individuals accountable. So you can't have one without the other. You can have as much political will as you would like. What will always happen as soon as there's a change in political parties, new government comes into place, etc., you have the risk of that falling by the wayside. So as long as you have the change public will, and you've got those public champions who are people of the public, who are respected members of society, who will always go on to drive that accountability. And that is then all how you get to policy adoption. And policy adoption is obviously when you use the combination of what you've developed here to put forward certain things to your governments, etc., which hopefully results in policy implementation at the end of that. We have also taken the time in our rare disease space to work out who our actors or our stakeholders are in each of these processes, to determine essentially who we are needing to partner with in order for us to get this off the ground. And then obviously we've taken into account some basic assumptions, and those assumptions sometimes seem, really blasé, but you need to have organizations who are willing to partner with you, and you need to ensure that the public understands the plight of patients. And so there's always a lot of work that comes into these sorts of things. And a lot of these issues, fundraising is continuous, data collection is continuous, problem assessments are continuous things, because as you achieve in one area, you might lose in another, or within any political framework, things are continuously moving and you're continuously needing to think on your feet and do things a little differently. So this has been the essential process that we've followed in South Africa, and it's been really, really helpful for us to map out. This is a basic example of a stakeholder mapping that we've done previously, where we've highlighted who the stakeholders are. We've worked out what our power to make, what their ability to make changes, are they well connected? Could they oppose what we're doing? Do they stand to lose or benefit from what we're doing? Their appetite for adverse outcomes, etc., so that you understand every group and every stakeholder needs their own sort of level of engagement, because it's not all copy and paste, unfortunately. And then we also developed a little bit of a stakeholder risk metric. So we understood exactly who was necessary to be engaging with. And here we've got on a power scale and an interest scale. And so we have managed to develop who we need to keep satisfied, who we need to manage closely, who we need to keep informed, and who we need to monitor. And essentially, this is how we have gone in terms of developing our local policies and the roadmap that we have used to develop what we have done up until now. And again, it's just a shout out to anybody who's out there wanting to engage in this process. It's not always sunshine and roses, unfortunately. We'd love to say it's easy, but if it was so easy, we'd all be doing it, right? And to just keep batting away. Like I said, sometimes something that you do today will only have a benefit 3 or 4 years from now. That's one of the risks of advocacy. But I can absolutely assure you that along every step of the way, there will be little wins, and those little wins is what keeps you motivated and moving forward. So that's essentially it from me.
Kelly, wow, thank you so much. It was so interesting, and I feel like I've learned masses about how to tackle, policy and engagement and thinking about advocacy from that talk. It was fantastic, and a lot of people are commenting on your theory of change slides, just something that's really helpful way to break down the ways to think about tackling these problems. I think it's amazing. So thanks for that. I mean, you mentioned in your talk, and I think you touched on it at the end there, just that change can be so slow in this area, and I know that can be a source of frustration to loads of groups out there. Is there anything particular you do to really try and help you manage that and cope with that? Is it just about looking for little wins, and what can you advise people out there who are trying to make those changes?
I think it's so important to always analyze and have long, medium, and short-term goals. Because in the moments, the long-term goal needs to be the policy development in the long term, but along the way, you want to make little changes. And even if it's, a hospital change and a small change to minor policy, etc., those little wins will essentially be the momentum that pushes you over the next speed bump. So it's really important not to put all your eggs in one basket and have one long-term focus alone, because it will probably really, really put your mental health at risk. So it's not, you've got to kind of balance it up and try do things that also provide you with some short-term momentum and short-term positivity and wins. Yeah.
Absolutely. Kelly, thank you so much. Really interesting. We'll definitely be coming back to you at the end of the session if you've got the time for some more questions. So audience, please, and any questions you've got for Bojana and Kelly and the rest of the speakers, please do pop them in there. Kelly, thank you so much. Okay, I'm going to welcome our next speaker to the stage now. At this point, I'd like to dive in from the kind of focus on individual countries to look at an international scale. I think it's really important to see what's happening across multiple different countries. I'm going to start at the biggest stage we've got. So with that, I'd like to welcome Flaminia Makia from Rare Disease International to the stage. So Flaminia has been involved in loads of the work going on at the RDI right now, but particularly the recent developments in the UN resolution. So I believe we're going to hear a bit about that work from Flaminia next. So Flaminia, welcome.
Thank you very much. Let me share my screen up. Can you see it?
See the screen. If you just want to go into full screen mode for the menu, that'd be amazing. And feel free to turn your camera on if you'd like to as well, because the audience can see you speaking when you do that.
Oh, okay. So yes, I cannot start my video because it has been stopped. It's not a problem.
Does that help?
Start my video. Yes.
There we go.
Yes.
Beautiful. Thank you.
So thank you very much for inviting me and for this opportunity to share an example of global grassroots campaigning and advocacy. Can you hear me well?
Absolutely perfectly. Thank you.
Okay. So I'm trying to remove some of this hide video panel, floating meeting control. Yes, it should be fine now. Yes. So today I would like to share with you how did we get a UN resolution and why did we so much want a UN General Assembly resolution? What is the resolution about? And if I have some more minutes, what's next? So who has been leading the process? It has been really the work of 3 civil society organizations that were leading the campaign. So this is Rare Diseases International, the NGO Committee for Rare Diseases, and EURORDIS. We led the grassroots campaign with the members, RDI members and EURORDIS members, and we led the identity on social media. And we also supported the core group of member states throughout the whole process and throughout the whole campaign. So what is the core group of member states? They were leading the negotiations within the UN with the other member states of the United Nations. And these 3 member states are Spain, Brazil, and Qatar. So what they did is that they officially sponsored the UN resolution within the United Nations, as I said. They organized the negotiations with the member states throughout the whole process. They, of course, introduced the draft proposal officially, because this cannot be done by civil society organizations. And they co-sponsored all the events that we as civil society organizations were organizing in order to raise awareness on the resolution, the importance of the resolution for the community, and the key asks that were developed within our membership. So the early co-sponsors, so the way it works is that Spain, Brazil, and Qatar, they are the first ones. They present the draft resolution to their peers, to the other countries. And then there are a certain number of countries that have decided to be early co-sponsors of the resolution. And this is the list you have here. So as you see, pretty much of a geographical balance. So we had Europe, we had Africa, we had Latin America, we had different areas in the world. So that was very, very, very encouraging, I would say. And this, so sorry, just to say that really this work to get the national level really to support the resolution is, of course, a work that is led by the national alliances in the different countries as well. So, of course, this was a pretty long way that starts back in 2016 with the first high-level event of the NGO Committee for Rare Diseases at the United Nations in New York, followed by a second event on Rare Disease Day 2019, where really the links between universal health coverage, rare diseases, and the call for a resolution progressively was shaped and supported by different countries at the UN. Then, as of January 2021, so one year ago, with the membership, with the participation of the advocacy committee of RDI, wide consultations within the community, we came up with 5 key asks that I will tell you a little bit more about in a moment. And we proposed to the core group of member states the draft proposal from civil society. Then in March last year, the very beginning of March, because it was officially the Rare Disease Day policy event of last year, which also was the third high-level event of the NGO Committee for Rare Diseases, we launched the campaign. Of course, it was an online event and it was extremely well attended. Then between March and July and also September, so all the year long, there was the reaching out to permanent representations in New York. So there was really like 2 parallel work streams, if you want. One was really the grassroots campaign and members, patient organizations at national level, reaching out to their national authorities and sometimes also to their embassies in New York, in coordination with RDI, mainly leading the reaching out to the UN permanent representation, well, to the permanent representations of the UN member states in New York. This was throughout the whole year. In July, there was also a high-level political forum side event that was co-sponsored by the core group of member states, Qatar, Spain, and Brazil, because once again, it has to be sponsored by a member state, and the core group was even stronger than only one country. And then in September, We organized, always with the support of the core group of member states, 6 regional group meetings in order to have civil society expressing directly to representatives in New York the reason for which a UN resolution on addressing the challenges of persons living with a rare disease and their families was so important to them. The final steps were really between October and November last year. In October, the informal negotiations between the core group of member states and the other UN member states started on the draft proposal by civil society. And every time that the core group of member states could, gather some sort of maybe reticence or some concerns expressed by other countries, they would always inform us, and we would support them and enable them to respond in the most appropriate way to concerns expressed by other countries. It was really a very powerful collaboration. And we were always pulling in also testimonies from our community to make sure that countries and representative of countries at the UN would hear stories from real life. So then in November, there was the so-called silent procedure, which is a technical thing, but let's say that when the silent procedure is not broken, that means that most probably the resolution will be adopted by consensus at the 3rd committee of the UN General Assembly, and this indeed happened on the 15th of November. And so just for information, when a draft proposal for a resolution is adopted by consensus by one of the committees, in this case, the 3rd committee of the General Assembly, when it's adopted by consensus, it means that there will be an official adoption, a pretty easy official adoption at the General Assembly, and this happened on the 16th of December. So this is to show you really the length and the importance of the preparatory steps with the community, and how important it is to really bring on board the whole community and really lead a grassroots campaign. And why did we want so much a UN General Assembly resolution? So clearly, as you know very well, the persons here interested in rare diseases, we all know that living with a rare disease goes far beyond only health concerns, and that it affects the whole family. So we really positioned a life with the rare disease, and we made it in parallel with the different sustainable development goals. So we firmly positioned rare diseases and the challenges of living with the rare disease within the Agenda 2030 of the UN, and the motto to leave no one behind, which is at the core of the Sustainable Development Goals. So clearly, leave no one behind also means leave no one living with the rare disease behind. And so just to show you the way in which we did it is that if we and this we did it really with our membership. It's very important to underline this, that we went through a life with the rare disease. So it impacts very early in life quality education, which is Sustainable Development Goal number 4, because many children living with a rare disease have difficulties to access quality education, even when they perfectly could. The whole family experiences more expenses and less income, so there is a greater risk of impoverishment, no poverty. Then, as we know, women are disproportionately affected and discriminated. So it also links with SDG number 5 on gender equality. Access, so getting, remaining, and returning to work is also challenging for persons living with the rare disease. So this is a link with SDG 8 on decent work and economic growth. And then there is the obvious SDG about health and well-being, and also it links very much with innovation, need for innovation or lack of innovation sometimes, so, and lack of knowledge and expertise, lack of appropriate health and social care. And as we all know, unfortunately, with the COVID pandemic, all these pre-existing inequalities and vulnerabilities have been heavily aggravated. Also, so what is the resolution about? So with our membership, we came up with 5 key asks. And these 5 key asks cover human rights and inclusion, full participation in society, the need for appropriate care, the request, the call to member states for national measures and national action, more inclusion of rare diseases within the UN system, and there was also a request for monitoring progress. So what is in this resolution? So the request, the call is really to address the root causes of discrimination, also through awareness raising and more accurate information. Also a call to collect disaggregated data specifically for persons living with the rare disease to identify what are the patterns of discrimination. Also access and underline the right to education for children, teenagers, and also for lifelong learning for adults living with rare diseases, and the promotion of access to employment and decent work. And also, and this I think it's very interesting, there is currently, this is out from the current text of the resolution, is linked to our asks, but this now is set in stone. This text is what is in the resolution. And very interestingly, there is also an ask for facilities for dependents and the promotion of equal sharing of household responsibilities to reduce women's and girls' disproportionate share of unpaid care, which I think it's pretty, how do you call it? Pioneering to have this within a text. When it comes to appropriate care, there is really the call to strengthen healthcare systems, also in terms, and notably in terms of primary care. And there is very strong language about universal health coverage. There is really a call to member states to accelerate universal health coverage by 2030 to cover all persons living with a rare disease and to stop the rise of out-of-pocket expenditure with a special emphasis on persons living with the rare disease. Very importantly, there is also this call to encourage the creation of networks of experts and expertise and multidisciplinary specialized expert hubs. There is also a call for supporting research through international collaboration, coordination of research efforts, and sharing of data. And when it comes to this appropriate care, we were very happy to see also the promotion of mental health and psychological support for persons living with the rare disease and for their families and caregivers, which is something that is very often overlooked, and we all know how important that is. There are also the specific calls to member states. So to adopt national strategies, plans, and legislation to contribute to the well-being of persons living with the rare disease, including human rights. Also the reiteration of not leaving, leave no one behind. and to adopt national measures to ensure that persons living with the rare disease are not left behind, but also to ensure that they are not disproportionately affected by poverty and lack of access to decent work, and also the recognition that they may need special assistance to access education, employment, and health, and also to promote full participation in society and social integration for persons with rare diseases, but also their families and caregivers. This is the specific ask about inclusion in the UN system. So really to ensure that the Agenda 2030 is inclusive and accessible to persons living with the rare disease. And then there is a mention of the elimination of barriers in accessing water, sanitation, and hygiene. This is really a request from member states. It's not something that we had put in necessarily, and it's of course very, very welcome. There is only one of our key asks that actually we did not get, which was the ask for monitor the progress of the status of persons living with the rare disease on a regular basis. Nevertheless, the multifaceted nature of the challenges of our community has been recognized, and this issue will be reconsidered in 2023 at the 78th session under the item social development. So what is next? Obviously, the UN resolution is not a goal in itself. Obviously, it's very important in terms of recognition of the challenge, of specific challenges of the population of persons living with rare diseases and their families. And it's also a way to take this community out of the shadow and put some light on these specific needs, but it will make a difference to persons in the next steps. Let's see, we see this UN resolution as a key or as a door to much more work to do in order to ensure the implementation at national level. So obviously we have to continue advocate for plans and measures and strategies for specific to rare diseases at national level. Also, we will continue to engage with the WHO. We will actually engage much more with the WHO, because now that we have secured an inclusive approach of rare diseases at the challenges of the population, we can concentrate our efforts on health, appropriate care, everything around universal health coverage. Also, of course, we can continue to work more around human rights with the Office of the High Commissioner for Human Rights and with other UN agencies and programs such as UNICEF when it comes to children and education, UN Women when it comes to gender equality, the World Bank, the ILO for employment, etc. So yes, thank you for your attention, and I'd like really to underline the importance of working together with the community at every step and underline the magnificent work that has been done at national level during this adventure. Thank you.
Thank you so much, Flaminia. That was really interesting, and from what you're saying, it kind of strikes me that, you know, what the resolution has allowed us to do is create almost a top-down pressure on governments and policymakers, saying that there's some consensus that rare diseases are an issue, and it's not just going to be that bottom-up grassroots pressure that's been there to deliver change, which is a kind of a new position for us in this space, which I think is really exciting. It'd be fascinating to see how we can make the most of it. I mean, are there any kind of quick top-line things that you'd say that, you know, the average rare disease patient group out there that's listening now should be trying to do with this resolution? Is it just shout about it, or what can we do to practically help that cause or help them?
It's a question to me.
Yes, if that's
yes.
Okay.
So yes, well, I think that what will be important now is really the synergies between the national level, the regional level, and this global framework that has been now possible, that is put there. Now it exists. We have an international framework. As you say, it's a piece of document that has been signed by all 193 countries of the UN. There is now a global commitment to that. And what we hear from our membership is that now the time for national action has arrived, right? It's not that nothing has been happening until now at national level, but now there is something that they can appeal to even more strongly to say, well, South Africa, for instance, or Serbia, you have committed to this piece of document. Now we want to see the result. At national level, we want you to take more action to ensure universal health coverage until 2030. And so there is really this synergies between the three levels, the global, the regional, and the national levels, that can be really stronger now. So I don't know if I'm answering to your question, but I think that when we see what Bojana was able to do in Serbia with the support she was able to put together, what Kelly has been doing in South Africa, well, this UN resolution gives even more strength to whatever you have been and you will be doing at national level. So this is the way we see it. And I think the urgency now, I mean, the priority now is around universal health coverage.
Thank you. It's a brilliant answer, actually, to a question. And I think the passion you've got for it really shone through there, and really appreciate it. So thank you, Flaminio. It's great to hear about that. I'm really glad we could showcase it at the event today. We will come back to you with more questions at the end. At this point, I'd like to welcome our fourth speaker to the stage. And I think right now we're going to bring in Jeraine Wong Riga, who's going to talk to us about some of the work that's happening in the APEC region, the Asia Pacific region, in the world of policy. So Jeraine, welcome. So glad to have you on the stage, and looking forward to your talk.
Well, thank you so very much. It has been just wonderful to hear the presentations before this, obviously, and also to be part of this group. And really much thanks to Find a Cure and your transition into a beacon for rare diseases for hosting this and having these different regions. So I'm really excited to be able to present about the Asia Pacific Economic Coordination. I'm going to be speaking, I think, in a couple of days about specifically the work that our Rare Disease Patient Alliance is doing in the Asia Pacific area. But at the moment, I want to talk about what APEC is providing for us. It's kind of interesting, I think, what APEC represents, especially in the context of hearing from certainly Flaminia and Kelly, you know, where we can kind of position, and it's of course Bojana, in terms of a lot of the stuff that's been bottom up, even the UN resolution. I think we know is very much bottom up, and you can hear from Flaminia how much work was done on the ground to make that happen. So this APEC Rare Disease Action Plan Framework Network is actually quite different. And I will have to honestly say it came to us without really the bottom up kinds of agitations. But I hope you'll see how it really fits in with what you've already heard and the tremendous opportunity that it presents in terms of advancing rare diseases, certainly across the Asia Pacific region. So let me see if I can get this slide set up. I think if I do this, it will show something. And you know, we're kind of getting good at this, and we kind of don't get so good at this, right? So really thank you for the opportunity. And it's just a brief update in terms of what is happening with regard to the rare diseases and, you know, from an APEC perspective. And hopefully you'll see that it's a very different kind of a beginnings, but also a huge amount of opportunities for grassroots works. And we certainly have been working with our members in the Asia Pacific region. Just to put in context, I'm here in Canada, Toronto. I am president and CEO of the Canadian Organization for Rare Disorders. I also serve, as some of you will know, as chair for Rare Diseases International. So just, you know, really have been so pleased with the kind of global work that's done. But I'm also president of the Asia Pacific Alliance of Rare Disease Organizations. So putting on that hat to really talk to you about APEC. So what is this and why is it important? First of all, just a brief background on APEC, which I knew very little about until we entered into this. It is an intergovernmental forum, 21 economies, which includes, interesting enough, the countries that are in the Asia Pacific region, but also includes US, Canada, Chile, and Mexico, and Peru. So countries that border the Pacific, I guess is what it means. It really is an economic forum. And really what they do is as they say, their goal is to promote balanced, inclusive, sustainable, and innovative economic growth. So first and foremost, what they're trying to do is to put in mechanisms that will actually contribute to the regional economic integration, but economic growth. So that's their first and foremost objective. And what they do is they host regularly these meetings, but they have hundreds of committees and subgroups that work, in some cases, very actively on ways in which they can cooperate where they see a common benefit in terms of promoting the region and promoting the economic viability of the region. And they definitely have a health and life sciences stream. And I think it's a real wisdom that's come out of it, and a little bit of what Flamenia has been talking about as well, and that is the recognition that health is wealth. And the recognition, explicit recognition, is that you cannot have a healthy economy unless you have a healthy workforce, and you can't have a healthy workforce unless you have a healthy population. So this is really ingrained in everything that they're doing. They meet several times a year and includes the most high-level seniors that come there. So their meetings draw in the heads of states and it draws in the senior ministers. These are the 21 economies that they represent. This is kind of the listing of it. And as you can see, it includes Russia, includes many of the countries that are in the Asia Pacific region, and also Australia, New Zealand. And as I say, those are on the other side of the Pacific, which is a very unique kind of a network. Established in 1989, I won't go through all of this, but really they work so importantly on non-binding commitments. It is a consensus, it is a collaborative, it is a cooperation forum. And so they work together, but they do work together on a voluntary basis. And this is also the distaff side of it, is the notion that yes, we can agree and we can commit and we can sign something, but in some respects, these are non-binding. I'm not exactly sure what non-binding commitments mean, but that is how they work. And certainly there's been a huge amount of success out of APEC. So why is APEC working on rare diseases? I mean, it is an economic, coalition, not really a disease specific, but they do have an important life sciences stream that works both from the point of view of promoting innovation and development in the life sciences, but also recognizing, as we say, the importance of a healthy population. And for I think for us, it was really quite refreshing to be involved with them in terms of talking about it from the point of view of rare diseases, and recognizing that, first of all, to the whole APEC region, over 200 million people are affected. Rare diseases, as their manifesto said, shine a spotlight on the gaps and barriers in our health system. If we solve these issues for rare diseases, we improve the system as a whole. And certainly our engagement with APEC has really underscored that, that philosophy, and certainly their commitment, the deep belief that being able to resolve and be able to address these issues on rare diseases will help us be able to address many other issues. And we need to make sure, I think as the UN, WHO have said, if we're not able to take care of what might be the least of these, then we're not going to be able to take care of anybody. And what the other thing that's been very important in the approach is that it's a whole government approach, a whole society approach that they're pushing for best practices. So it underscores, I think, what Flamenia was just talking about in terms of what is it that we're pushing for. We're not just pushing for, an address in terms of treatments for rare diseases, but we really are recognizing that rare diseases affects a broad swath in terms of the issues from social to economic to educational to occupational, and certainly requires then the integration of many sectors. And again, they're in a great position to do that. So this is what they've come up with, is what was the problem? Well, it has more than half of the global rare disease burden. So this is in this region, and probably maybe up to 2/3 of that burden, quite frankly. So it is a significant, draw on the economies, and it's a significant impact in terms of the health and well-being of the population, and recognizing some of the things that we've talked about already. So in 2018, they brought together a huge gathering of stakeholders, including some of the top level officials, top level health officials, top level policymakers, and importantly enough, included representatives from the patient groups in that region. Small number, but really significantly at the table along with everybody else. And actually had been in that meeting the opportunity to really address what are some of the challenges that we see in terms of rare diseases. And out of this then, came up with an action plan. And this action plan then was actually endorsed by the APEC health ministers in 2018, signed on the line by the health ministers. What's what is it? It is, in fact, what I repeated before. So in 2017, it was taking everybody through this network to end up with the Rare Disease Network. So it was a multi-year effort, and it really was driven by a number of different parties to get to a plan, an action plan. Involved certainly a number of companies that were key in terms of driving it. Involved a number of member states, member economies, I guess they call it instead, and key representatives from the technology point of view, from the life sciences point of view, from the academic point of view, and then industry point of view. And then we were brought in, Rare Diseases International, to really provide a nexus point for the patient perspective, but drawing in many patients there. And I sit as the patient advisor to the APEC Rare Disease Network. So what is it? That's the structure. I think importantly, as you can see, it really does include the government and it includes the academia, which is high level buy-in right from the beginning. And certainly the ability to get the attention of the key people that are important in terms of making things happen, but also the academia, clinical, and as they say, 15% of the membership includes patients and patient advocates, which again is important to ensure that we've got the buy-in, but also the ability for those on the ground to be able to take advantage of it. The action plan is actually quite ambitious. And over the years since 2018, there have been series of workshops and forums that have been trying to develop it. I will say is that COVID had a huge impact in terms of the continued advancement of the implementation of the action plan. What happens is that APEC has revolving chairmanship. So in every year, there's a different country that's the host. And since 2018, there have been the opportunities to host an APEC Rare Disease Forum in the host countries alongside of the other activities that they were doing to advance and to get buy-in on rare diseases, not just from that host country, but from all the countries, but really driven by the presence of key policymakers. So I think that's the advantage that certainly APEC has, is they can bring in the high-level policymakers. They can bring in the other sectors that certainly is even as effective as we might be as a patient advocacy voice, or effective as we might be in terms of other sectors, does not necessarily guarantee that we're going to have that buy-in. So this is what was, happened. The various best practices were validated at our first APEC dialogue. I thought I had a picture of it, but I don't. So I would just kind of say that we actually had quite a large number of representatives there at that first meeting, which was really quite exciting, including a number of us as the patient community. They put forth a vision for 2025, which I think might be a stretch for us to actually get to that vision, but it does lay out very clearly recommendations, 70 recommendations, 30 targets with very specific indicators in each one of those targets, which again, as I say, will be somewhat of a challenge to meet, but it does provide a benchmark and does provide a pathway. So it's been translated into a number of languages. This is what is essentially in the 10 areas, and I won't go into the details. Many of it you will be kind of familiar with, but really starting with the notion that we need to be able to have a definition for what is a rare disease, and not necessarily saying that it has to be a single definition across all the countries, but that each country should at least be able to define what is a rare disease. And while those in Europe maybe and the US may be quite familiar with that, we know that in many other countries, there's not necessarily a definition. And then everything from the public awareness to ensuring, human capacity, early diagnosis, coordination for patient-centered care, delivery of new and accessible treatments, financial and social needs, which I think for many was talking about, the pooling and usage of patient data securely and effectively, which is of course one of the most important assets we will have moving into the future, but also one of the most challenging barriers. So this is what, has, and then to pull it all together into some form of a comprehensive domestic plan. So what's happened as a result of this? Just quickly to say that with APEC and with the, hosting of forums, but also the working with the different policymakers, the different leads in terms of the various ministries, these are some of the things that have been able to achieve. In Peru, they got the Minister of Health to draft the regulation of law to implement the rare disease law that was passed 8 years ago. So Peru had a law, but it had not been implemented. In Mexico, they've been able to get the senior members together to chart the initial strategy. What we saw in Rare Voices Australia was certainly the patient organization, being able to lead the stakeholders, but to really get the buy-in in Australia as a key APEC country to adopt the National Strategic Action Plan. APEC functions very strongly in People's Republic of China, where in fact we launched the 2018 networking action plan, and has really been as they say, the kickstart to an amazing number of initiatives, laws, medical advances in terms of defining rare diseases, medicines for rare diseases, the genetic testing for rare diseases. So this has been a huge platform for advancing the work in China, Hong Kong as well, and then also Thailand, which I think is the host country this coming year. So again, being able to really leverage the different stakeholders from the policymakers, academics, and certainly engaging the patient groups there. This is Malaysia was the host 2 years ago. Unfortunately, again, was a virtual conference. It was very exciting by being in Malaysia, hosting the forums, getting the high-level participants. What they ended up with, something they had not had before, is a written policy on rare diseases. They have now got the commitment and are beginning to develop a rare disease registry. They've put forth a trust fund for rare diseases so that patients, can actually get access to hospitals and other kinds of services, and are now updating their list of rare diseases and hopefully, emerging into the ICD-11 classification. All are important building blocks toward having genuine policies and services for rare diseases. And importantly, the patient organization is central to it. For us as patients, one of the most exciting things that happened in this forum was that there were many patient groups in Malaysia for rare diseases. They all came together under one umbrella, in part because with this policy going forth and with the government willing to advance it, they said we need to have a single point of contact. So everybody comes together. We will have you working as a coalition. Otherwise we cannot have the patients involved. And that has been very effective in terms of bringing together the community there. These are some of the forums that were taking place, again, also virtually. Had the opportunity to participate in many of them myself in terms of presentations. But as you can see, always having high-level policymakers as well as academics and researchers there, and being able to spawn out of that then a resolution and research programs, action plans, and this is in Chile, a mechanism for financial support. They had already had a law that actually would support diagnosis and treatment, but that law then was extended to rare diseases as a result of the focus work there in Chile. The National Network of Patient Care, bringing together many of the centers that were involved in rare diseases to begin to network them together, to expand the care, to share the learnings. A national registry has been implemented, and there is in fact a ministerial office for rare diseases. So this has been an important, kind of a way of focusing the work there. These are some of the objectives then that were identified for 2021. I will say again, a lot was done, but really somewhat stymied by the fact that people could not get together. And even though there were a host of a good number of actual very high level and very effective seminars, it's not quite the same as getting everybody in the room together as you might imagine. And then these are some of the other things that you've already seen that we talked about. This is the plans for 2022 and beyond. Hopefully we're able to pick up with the forums. There will be, in fact, meetings that will take place. The virtual meetings are quite effective, the dialogue series, and also the ability to really kind of focus on some of the key challenges and then to be able to, two big things I think that are really important. The Regulatory Harmonization Steering Committee, which works across the region to not just for rare diseases, but also trying to harmonize and coordinate regulatory policies and practices across the region. But the focus on rare diseases will be significant if we want to accelerate the ability to get access to therapies for rare diseases, and also then the healthcare financing project to further again the continued discussions on the funding for rare disease treatments as a regional strategy, which again is quite important. And that's it. So we're actually quite excited to have to be a part of it, and hopefully we'll be able to do even more to engage the patient populations and the patient organizations in the region to take an active role. Thank you.
Thank you so much, Doreen. Really interesting to see such a breadth of work happening across such a huge geographic area, and different policies kicking off as a consequence that's coming together. I think it's really encouraging and exciting. Just wondered very briefly, are you beginning to see a difference in either the patient experience or the patient engagement with some of these policies in these different countries? And is it really leading to that grassroots change?
Well, I think as Kelly indicated, there's a long journey to getting to the policy. In fact, in this case, we're starting with a commitment to the policy. It's an equally long journey to get it to have a meaningful impact in terms of people. But yes, we are. And what we're trying to encourage the patients and the patient organizations to do is take advantage, be involved, use the kinds of policies that are being proposed and put yourself forward, right? And there is a huge commitment from the APEC Rare Disease Network that patients and patient groups must be involved and must have a role. So I think that was a big push for them, though. They were economies. They were used to working in very high level business finance. And, I think a lot of them took a lot of persuading to even wonder, like, why are we bringing in patients? What is the value of this to us in terms of what we're doing? Aren't they kind of just getting our way? So I think it's been a great opportunity, and it gives us access to many people that we would not have access to otherwise.
That's fantastic. Doreen, thank you. It's always a pleasure to listen to you talking about all the work you're doing. I'm going to hear a lot more from Doreen for the rest of the week. So we'll come back to you hopefully at the end of the session. Final talk now, and I'm really pleased to welcome Anna Cole to the stage. Anna Cole is from Eurodis and is going to dive into the work at the European level, which is obviously where we're based here at Beacon, and we're looking forward to hear about what's happening in policy changes in the European Parliament and the work that Anna's been doing. So Anna, welcome, and thank you for joining us today.
Thank you for having me. Hi, everyone. As Rick mentioned, I'm going to be focusing on the European region, and it's really nice to see how common themes, common messages, I think, between my presentation, Doreen, and some of these actions that are happening in other regions of the world, and how they are all aligning, as Flaminia mentioned, as we would wish to happen under a sort of international framework. So today I'm going to tell you, hopefully very quickly, I know everyone's on their last legs, about our action plan campaign in Europe. Ultimately, what we're trying to do is renew the policy framework that currently exists and make it a bit more updated. So to give you just a few facts and figures, as you probably know, we have 300 million people living with rare diseases globally. 30 million of those are in Europe, about 25 million in the EU member states. And here's just a spread of some of the countries in Europe in terms of the populations that they live with. I just updated my figures for you Bojana, I saw 350,000 in some places. I guess all that to say that it's probably very underreported, but also to say that the main goal of putting together action plans like this, whether it's in Europe, in the Asia Pacific region, or anywhere else, is that we can't really individually do any one of these things, disease by disease area. We probably can't even do it country by country. So it's important to always put these figures up front and to show that it's really a public health and a public policy priority, and that ultimately we want some of the odysseys that Bojana lived through to become exceptions, but some of the action plans and laws that are put into place to become sort of regular. So this is really an attempt to make sure that each country in the region is equal as much as possible in that way. Having said that, a lot of the actions that happen for people with rare diseases happen very locally. And so member states really need national plans in order to translate that into something that's meaningful for patients. So I tried to make the link here between the UN resolution and what it means in Europe in the next few years. Ultimately, you saw that there were a unanimous vote of adopting the resolution. And within that, a number of countries in Europe that were early sponsors, but finally 11 of those who were co-sponsors actually of the resolution. But in the end, it's going to be hopefully implemented across all of them. So the resolution is really a demonstration of the fact that EU member states have acknowledged all of these needs, and that there are now the need to translate that into something operational in order to address these 5 asks that were described in the resolution. Sorry, I lost my flicker here. To let you know a little bit about where we are today, currently the framework that we have in Europe is really based on 2 pieces of soft legislation. Again, none of these are binding. And that is the 2008 Commission Communication on Rare Diseases, which was a horizon scanning of the needs of people living with rare diseases, as you can imagine, across diagnosis, research, patient advocacy, data, and more. And then followed by 2009 Council communication, in which case the member states sort of self-mandated that in order to address those challenges in the communication, they need to have a national plan. And so they agreed to the fact that by starting in 2013, that member states would implement a national plan. Now, despite the fact that communication did lead to about 25 national plans adopted across Europe at some point in time, it doesn't mean that they're all active today, and it certainly doesn't mean that any of them were adequately expansive in scope, that they were well funded, or that there wasn't major room for improvement. In a similar way, although we have this framework in place, we know, which is why we're all still here today, that there are major unmet needs for people living with rare diseases. And just to give you a few facts in terms of Europe, much like the rest of the world, we have an average of 5 years to diagnosis, but that can span up to decades, of course, for some of us. Half of people have reported in our surveys that they are significantly impacted in their day-to-day life in terms of the financial, social, and psychological impact of living with a rare disease or caring for somebody with a rare disease. And we all know that there are only 6% of rare diseases that have a dedicated treatment. Very few of those are transformative in any way. And if we keep going as we are, there have been projections that have been done to show that we'll only have 600 new treatments on the market, at least in Europe, available by 2030. So lots of room for improvement and lots of unmet needs that are not acceptable. We all know, of course, that one of the major problems or weaknesses in terms of human rights is that there are major disparities for people living with rare diseases as compared to people living with no disease at all or other diseases, more common diseases, and that the COVID-19 pandemic has only exaggerated that. So in our surveys as well, we've demonstrated that around 84%, so a massive majority of people's care in terms of their disease has been entirely disrupted or delayed. And we know that in general, people living with a rare disease have a worse health experience than those with other chronic diseases. We also know, of course, from country to country, that this can vary tremendously, not only in terms of the quality and access to care, but access to treatments on the market. So again, all unacceptable unmet needs that still require much policy change in order to be improved. So again, because of this 2009 and 8 policy, it's clear that it's a good moment in time to change and to update it. And then, much like many policies in any sector, whether it's health or otherwise, we need to have regular updates and regular cycles. So we're not the only ones who recognize that. There is a Court of Auditors, an institution in Europe, whose job it is to do just that, really to audit the spending of institutions like the European Commission and to make sure that the policies that are put in place are done so effectively. And so in 2019, this Court of Auditors was reviewing one specific piece of that framework that I mentioned, and that is the Cross-Border Healthcare Directive. And to make a long story short, they demonstrated that it is not being implemented in an adequate way. And in fact, they went one step further, recognizing that accessing care is only one piece of the puzzle. There's diagnosis, there's affordability, there's the family, there's being included in society. And so they went one step further to say that, in fact, what we recommend is that not only is the Cross-Border Healthcare Directive revisited, but actually we should probably consider whether the entire rare disease policy framework needs to be updated, adapted, or replaced. And in its recognition, the Commission said, okay, we agree, and we will certainly do that where appropriate. And in order to do that assessment, we would like to go through a number of actions. And one of those was to consider really the future of healthcare policy through foresight. So Joris was the coordinator of a project called the Rare 2030 Foresight Study, and is a key element in the Commission's assessment of the current plan. Now, I say that because they had a timeline to all of these activities, and that timeline, as you can see here, is to be done by 2023. And you'll see in a few slides why that's important in terms of the actors that we needed to mobilize in order to make that change, and why it's been a helpful sort of pressure point for us to make sure that the European Commission does update or to finalize its assessment by that time. So this foresight study, just a few quick slides, started in 2019. It was 2 years long. There are not many foresight studies done in the area of health, and it was certainly the only one done in rare diseases. What's important to underscore is the fact that it was funded and supported by Parliament and the Commission. So in some way, shape, or form, we're doing our homework to help them assess their own policies. It was extremely participatory, methodological, and exhaustive and comprehensive review. And it included, of course, not only our coordination, but the collaboration of 8 partners, much like the process described by Durkheim, that went across academics, industry, policymakers, national authorities, payers, and patient representatives, and much, much more. So the partners involved in the project were some of the very recognizable and most dedicated actors in the field in Europe. That is Orphanet, Newcastle University, the Foundation Téléthon in Italy, ECNOVA, our experts in foresight, 2 European reference networks, and the Imperial College of London that was focusing very much on those projections in terms of drug development. And we wanted to make sure that our reflections were very representative. So not only did we need to lead people through the stages of a foresight, and I'll describe typically how that happens, but we also wanted to make sure that the right people were voicing their opinion, since ultimately we were going to be providing these recommendations to the Commission, and we wanted to make sure that our exercise was exhaustive. So we had a number of consultative bodies in that process. One was a research advisory board that was made up of former policymakers, either in the areas of rare diseases or in general in public health policy, a number of experts working on the ground in rare diseases themselves, and a number of representatives that were either experts in foresight or experts in new technologies, since much of the point of this foresight was to project into the future and not just continue with the status quo. The other bodies that we had, and the core one was a panel of experts. So here it says 200, but it ended up being probably more like 250 members across a number of categories of stakeholders that I just mentioned, including physicians that are part of the European reference networks, and a panel of young advocates, since of course the policies that we are all working on today are probably ultimately not going to affect us necessarily or anyone in our generation, but the generation ahead of us. And finally, there was an exhaustive survey that allowed thousands of people living with rare diseases and advocates not directly involved in the project to voice their opinions as well. Now that all culminated, and it sounds much easier said than done, in a set of 8 recommendations. And many of these are very much mirrored on the 5 asks of the European Commission, very much mirrored across the main pillars of the action plan by APEX. So it's nice to see that everyone's converging to these same areas of focus. They're by no surprise, basically the steps that a person living with rare disease goes across in their journey, that is from getting diagnosed to be able to function day to day and having access to the care and specialized treatments that they need. Now, none of this can happen, of course, if the right policies, programs, and services aren't in place. So first and foremost, the major recommendation coming out of this foresight study was that, surprise, we do indeed need to update our policy framework. And we need to do that not only so that the European Commission is dedicating a certain level of common activities across all countries, but that each country itself either updates, maintains, better funds, whatever it is, comes up with a sound national plan. So those were turned into the Commission at the beginning of May, and it really gave us the impetus to then start campaigning for putting those recommendations into action. What we didn't want is for those recommendations to sit on somebody's desks and for 2002, 3, 4, 5, 6 to move on without any change. So the campaign for a European action plan in rare diseases began. Now, what is an action plan? It's really a kind of new jargon, if you will, or new instrument at the European Commission level that helps identify currently unmet need, identify the targets, identify needed current actions and initiatives, and highlights flagship projects. So essentially very much what the Commission communication was over a decade ago. And it's always done with a very transparent roadmap, which includes a number of both smaller and public consultations so that you can get to a final adoption down the road. Now, what we hope that this European Action Plan for rare diseases will be in Europe is really the first step in order to reform the health and social care systems and to make sure that it delivers in a better way than the current framework does. And what we've tried to do in the way that we've proposed it is to ensure that it's presenting a number of measurable goals so that the key players can be accountable, not only in creating the programs nationally that need to make them happen, but that they can be monitored as well. We really hope that it can be a quite operational opportunity to realize some of these sustainable development goals that were mentioned and recognized and highlighted by the United Nations resolution. And in our proposal, we actually boil it down a bit further, although of course all of the other SDGs that were mentioned in Flaminya's talk are not irrelevant or hidden. It's just that we focused on these 4, and that is improving health and well-being, improving the infrastructures in terms of industry innovation needed in order to get the science to people, and to reduce inequalities, and of course create the partnerships needed to do that. So again, what we've done is based those all on this foresight study, and we've supported it all along the way with a grassroots campaign. So you'll see on the left here the 4 SDGs that I've mentioned. Those have been mapped to the 8 recommendations of Rare 2030. And we've translated those into 3 measurable goals that would then be elaborated in an action plan that would include 6 areas plus 2 cross-cutting areas of action. And then on the bottom, you'll see, I think, a sort of key mention of the fact that what we're working towards before 2023 is all good and well, but life is still happening, business as usual. That is, member states and other countries, for that matter, are coming up with national plans. Companies are making strategies for approaching rare diseases. Alliances are being born across the world. And so we really hope that although the action plan is not a live and implementable plan yet, the recommendations for Rare 2030 can actually help to serve those stakeholders that I just mentioned, and they certainly already have in some cases. So just to revisit what I started my presentation with, which is why do we need a new framework? Well, we certainly need to renew the focus on rare diseases. In the last few years, although we had very much a peak and a demonstration of how critical these cornerstone policies, the 2008-2009 cornerstone policies were for rare diseases, we feel a slump. We feel, of course, now even more, as everyone does, with the pandemic, that we're competing with other health priorities. But even before COVID, we could sense that the Commission and the institutions in Europe felt like the job is done, and that's just absolutely not the case. So first and foremost, we hope to renew that focus. Second of all, one way to renew that focus and one way to really insist on that accountability is to set measurable goals. How can we make diagnosis go from 5 years to 1 year or even 6 months? How can we make sure and reduce the psychological, social, and financial vulnerability that people are living with, and by how much? And how can we ensure that we don't get to 600 treatments on the market, but maybe 1,000 or even more? So as with the Sustainable Development Goals, and as with any public health or public policy goals, you need to shoot high. You usually don't meet them, but that doesn't mean that they shouldn't be set. And we certainly have enough of the baseline data right now to start to make reasonable projections. What's really key to this action plan proposal, and was a bit of the case already with the Council communication recommendation, is that it really needs to do a much better job of incorporating the whole spectrum of challenges of people that are faced by people living with a rare disease. So although there was an attempt to do that in 2008 and 2009, I think our values and our recognitions of how critical that is, whether we're looking at it from a human rights perspective or a health economics perspective, it doesn't really matter. The point is that everyone recognizes right now that you can't just be looking at little slices of the pie, but really need to be considering the patient and their daily life experience at the center. So this action plan would be an opportunity to make sure that we have a more comprehensive framework to connect all these initiatives. And finally, with this renewed focus, that's not only at the European level, but at the national level, reminding national authorities why the current national plans, if they exist, aren't adequate. So in our campaign, we've had to be extremely concise in why we need this. What I just described is a long-winded way of saying 3 things. Number 1, unmet needs still remain and they're unacceptable. Number 2, we don't have policies that are fit for purpose for the scientific potential that we have today. In 2008 and 2009, we hardly had the same treatments and therapeutic innovations in the pipelines that we do today. And we really need to consider how to make them more widely accessible, and not just in terms of reimbursement and prices, but in the fact that the drug development delays, the regulatory delays all need to be revisited, and they certainly already are starting to be done. And again, to just reiterate the last point, which is that we can't be working on these things in silos, and so a new policy framework will allow us to connect them. Now, who needs to hear this message? I think everyone probably online here today is convinced. But in terms of the European institutions, it's really the European Commission at the center of my slide, who we are waiting for in response to the Court of Auditors and in response really to the grassroots campaign and all sorts of calls for action, are the ones who need to make a change. So when we started the campaign, we really had to map, much like Kelly did in her theory of change, who are the actors who are going to make that happen. And in terms of the institutions, we know, of course, that the European Parliament can put soft pressure on the Commission to do so. And that very, very, very importantly is the fact that the Commission only acts in response to requests by the member states, by the Council. So the member states' call for action is very critical. Now, in order to influence, I guess, indirectly those actors, the Parliament, the Commission, and the Council, we knew we could rely on individuals. We knew we could rely on our members at Eurydice. We also knew that we could rely on many of the stakeholders that were involved in the Rare 2030 project, the physicians, the company representatives, what I call grass tops individuals who have already a platform and a well-recognized voice that can also send along that message for change. So that gives you an idea of the different levels of that our campaign strategy had to take. In terms of timing, I mentioned the fact that the Commission is somehow required to have considered all of this assessment by 2023. And politically speaking for us, why is that important? Well, as I said, because the member states are such a key player in pivoting the Commission's actions, we know that we could focus on what's called the European Council presidencies that rotate each 6 months. So it's not by coincidence maybe that the presidencies in 2008 and 2009 were also France and the Czech Republic, two countries that have a very long tradition of support for rare disease policy. So we're crossing our fingers that we can have a repeat in 2022. And what I've done here is map for you the kind of key milestones that will be really important for us to ensure success, starting with the Rare 2030 recommendations being delivered at the end of May, the kickoff of our grassroots campaign, the support of members of European Parliament in the debate, which I'll give you a bit more detail in the next slide, and then the EU Council presidencies, starting with France, the Czech Republic, Sweden, and then finally in the next trio of presidencies, Spain. So what happens at the end of each one of these 6 months is that working in trios, since the 6-month period is so short in terms of making any political change, France, the Czech Republic, and Sweden as a trio have committed to make rare diseases and the proposal for an action plan on their list of priorities. And that will be conveyed publicly, if you will, in a high-level conference that's happening on Rare Disease Day at the end of this month. Now, the other political window of opportunities beyond the Court of Auditors that I mentioned is the pressure from the Parliament. So actually in July of 2020 last year, Parliament addressed a resolution on the call for post-COVID actions, and that actually already included the need for an update of the policy framework for rare diseases. This followed with a parliamentary debate in November of last year, in which 19 MEPs addressed the Commissioner of Health. So that Director General that I mentioned is the key one that we need for change. And yes, in a very consistent way, conveyed their messages of why it's needed and necessary to implement the Rare 2030 recommendations, following, of course, the Court of Auditors report, and how the action plan is the best instrument and tool to do that. That followed by a co-signature of 41 MEPs with the same messages, and nicely coincided just before the adoption of the UN resolution. So as I mentioned, the next big milestone is a high-level ministerial conference that's supported by the French at the end of this month, and we hope will then pass the baton onto the Czech Republic, Sweden, and Spain in order of presidencies in order to adopt the final plan. Now, all in parallel, much like the UN resolution, none of this makes any sense if it's not illustrated by individual stories of support, not only of challenges, but also of solutions. So we collected a number of reasons from the point of view of people living with a rare disease for an action plan. As you can imagine, it's not always an easy thing to do. Your average person, whether they're living with a rare disease or not, shouldn't and doesn't think about EU policy or UN policy. So we've been extremely grateful and really blown away sometimes to collect so many stories that speak so directly, but in such a human way about why this kind of EU level policy would actually change something in their lives. So that book will also be published on the occasion of Rare Disease Day, as well as a video and an online resource in which all of the reasons will be compiled and downloadable for anyone who might find them useful, country by country. So I just wanted to circle back, I think, to one of the asks of the UN resolution. I started the talk by talking about our current framework and how, although it's been somewhat helpful in putting forward national plans in most countries, they aren't adequate. So we now have, as Flaminia said, really increased pressure. Again, it's not legally binding, but certainly a lot of weight coming from an institution like the United Nations. And as she also mentioned, really a historical commitment that now everyone can latch onto. This was signed, and now you need to deliver on your promise. So what we hope to see, of course, is that this adoption of a EU resolution will help give added pressure to the European Commission and to its member states in order to have an action plan, which will ultimately result in national plans in each country. Now, whether the technical way that will happen is with a new council recommendation in 2024 as part of this action plan, we're not really sure. For the moment, that's our proposal. But we know certainly that one way or another, by getting these national plans, we're going to be able to overcome a lot of the bottlenecks that member states already experienced when they came out with their first plans. That is sometimes a lack of accountability, certainly a lack of scope in terms of all of the social needs and connecting all of those dots together, sometimes a lack of indicators. And so really this UN resolution and the action plan and ultimate national plans can now really come up with something even more exigeant is the word in French, even more strict in terms of its requirements and really hold people accountable. So being able to really benchmark, which of course has its value as well. So what we hope will happen by 2030 is that in each country across Europe, we're going to have consistent, long-term funded, updated national plans. Now, fingers crossed, the action plan will be the instrument in Europe to make that happen. But nevertheless, as I said, business as usual carries on. So certainly the UN resolution and the Rare 2030 recommendations are already stamped, approved, and recognized, and hopefully can help that happen on a more organic way in the meantime. So thank you for your attention. And I'm happy to answer any questions anyone has.
Thank you so much, Anna. That was a really good talk, and great to see the kind of breadth of work that's happening to push for this new resolution plan at the EU level, something we want to see. We're stealing a little bit of time from you folks, but we're going to keep doing that because we've got such an excellent panel here and some questions I really want to put to them. So please stay with us if you can spare the time, and speakers, if you're all right to hang out for a few more minutes, we really appreciate your time to take a few questions, if that's okay. So I don't know if Flaminia, Rihanna, Kelly, you'd like to bring your cameras back on. Just a couple of questions I wanted to put to you all, really. So in the chat, we've had a few questions feeding through, and in particular one I promised that I'd make sure I asked, which is how can the patient groups at the coalface kind of better support. I'm sorry, I'm losing my thread now. How can the patient groups basically find a way to open the door, get their foot in the door themselves in the changes in policy? How can they kind of make that first step to creating change in their countries? Any advice that you could give would be really appreciated.
Yeah, I'll take a stab at it if I can.
Thanks, Kelly.
I think that the most important thing is to just start somewhere. And really it's just to, I think we all put ourselves under immense pressure to move the world in one day. It's not going to happen. Back yourself fully, trust your gut, and just start. And you keep up that momentum, you'll eventually get to where you need to be.
Thanks, Kelly. Brianna, any thoughts?
Yeah, well, I must say that we saw so many closed doors. So many people closed the door to us in that time when we fight for SOAS law. But somehow that sick children gives you the strength just to keep up, don't give up. Giving up is not the option. So thousands closed door, once they will open, you will find the right door, so just don't give up. That is the only advice. I don't have, concrete advice. You need to contact that person. No, because in that time we contact everybody. We just, but so just don't give up.
I think it's a great point now, and it feeds back to what I was trying to say right at the start of the day, that patient experience gives you the drive and determination to just keep going regardless of what challenges are in front of you, and don't let go of that, because that's the thing that's going to make a difference ultimately.
If I may add something.
Yeah, please do, Flaminia.
Yeah, I think that, we have different strategies, I think, that have been illustrated today. There is like Boriana with a very specific demand, and then from a specific case, you develop a whole policy and a whole strategy and a whole awareness, etc. And then there is a bit kind of the other way around, such as the UN resolution, for instance. It's a bit the other way around, but it starts from an essential element that is visibility and recognition, because what is mainly lacking where nothing for rare disease happens is this visibility. So if we associate visibility with some specific requests, with a strengthening of the healthcare systems in general, which is also what we need to be doing, and the dissemination of appropriate information, because what is very often lacking as well is what is a rare disease, where are the figures, how many are you, what is it, and all of that. So I think that, this is the winning way. It's to associate the specific request, the operational, the recognition, and the visibility. So the different levels, again, even within one country. I mean, I don't know what you think, Mariana.
And yes, I agree totally. Yes, and I must say, one advice also: don't make it, don't mix up with the politics, because politics are changed. I must say that we are totally no pollution, because during our fight, I met 6 ministers of health. 6 ministers of health, and every time, again and again, what is the rare diseases? What are our problems? Finally. The last one you saw on the picture, and you can see the film. So the last one is the bingo, you know, he recognized everything, and you know, so but no politics side, because you know, one day this is politic on the top.
Policy, but no politics.
Excellent call then. That's brilliant, thank you. Anna and Flaminia maybe bring in on this part as well. Just wondering, another question that's come up is what can those groups out there now do to support some of the big international actions that are happening? You know, are there simple things they can do to raise awareness? Are there simple things they can do to use it and support the efforts that you're making at that higher level at both Eurodis, at Revsys International?
I will say only one word, and then I leave it up to all the others. But I mean, for instance, we have developed a whole set of materials, a toolkit, if you want, a toolbox in different languages, etc. So indeed, use it. I think that it's, you know, we help you to help us, and we help you and you help us to help you, and it's, I mean, we are a community anyhow, so these toolkits are really out there to be used, adapted to the national needs, changed, modified the way you need it the most, but they are out there to be used. So I think that's a piece of the answer.
Thanks, Flaminia. And Anna, any thoughts on that?
We're cut from the same cloth, so I can only say the same thing. I repeated it a few times in my presentation. The Rare 2030 recommendations are there, and yeah, it's not only what it says inside, but who said it. So absolutely use it to your advantage. Bring it to your ministries. They just might not even realize that it happened. So as you mentioned, Bojana, you just need to repeat the same thing over and over and over again, and hopefully somebody will hear your message. So do use those recommendations, and don't hesitate, I think, to come to either organization to help you as much as we can, tailor some of the things for your use. So it's already done in some ways and shapes and forms, but we're actually a team of people who are very eager to make sure to translate some of all of this meta work that we're doing to something that's meaningful on a more regional or local level. So yeah, I would invite you to do that as well.
Thank you, guys. There are so many more questions I could ask and so many little lines I'd like to pursue, but I think it's probably sensible at this point to let everyone have a rest and head off ready for an exciting day tomorrow. I just want to thank all of our speakers for what's been a really interesting session. Jeraine as well, who had to step out for another meeting at 5. It was really great to hear all the talks. And I hope we've managed to paint a picture in this session that shows how you can work from the smallest base with a small level, the different approaches you can use to try and build your strategy for policy, and what different tools are out there now to provide different pressure on the people you're trying to talk to make change for your rare conditions, whether that's at the RDI level, the Eurodis level, the APEC level, or within your country. So, you know, please make use of those tools. Please shout us at Beacon or any of the guys here if you need more help and advice, and we'll be really excited to see what you guys out there decide to try and do next. So with that, again, thanks to our speakers. Thank you to the audience. It's been really engaged. We've really enjoyed it today, and I can't wait to see you all tomorrow for some more excellent breakout sessions, some really good main stage sessions. I think we're seeing Bojana again very soon. We're seeing Kelly again. Revsys International may have been again already, but there's a whole flood of different things happening throughout the day. So please check out your programs. And yeah, we can't wait to see you there. So with that, I will try and pop up my closing slide and leave you all to a very lovely evening. Thank you, and bye for today.